Hello and welcome to today's Advantage Sports Medicine Research Roundup. My name is Kevin and I'm a physiotherapist. In this video, we'll be looking at osteoarthritis and specifically the impact of the condition at the knees and the hip. So let's get started. The diagnosis of osteoarthritis has conventionally been associated with X-ray changes, but often the changes seen with X-rays may only start showing clinical signs of degeneration many years or even decades after the actual start of the disease. Therefore, we're missing a significant key window of opportunity for management and prevention. So let's get the conversation going about osteoarthritis. We can do this by understanding the importance of daily activity and exercise, understanding the mechanics of our body, healthy movement patterns, and being aware of avoidable risk factors such as obesity. We can be the catalyst for our movement towards a healthier community, as well as improve our odds for disease prevention and in combating disease progression. So, what is osteoarthritis? Osteoarthritis is one of the most common types of arthritis, which is a chronic disease involving inflammation of one or more joints. Now, osteoarthritis affects about 3 million Canadians, and it is an aging-associated disease most commonly manifesting in adults after the age of 50, with the hip, the knees, and the hands being the most commonly affected areas. Osteoarthritis is a complex disease that results from the breakdown of the entire joint, our bones, tendons, muscles, and most importantly, the breakdown of a supportive connective tissue known as cartilage. More specifically, a type of cartilage known as articular cartilage, which is a highly specialized, smooth and lubricated tissue that covers the ends of bones. Now, in osteoarthritis, this becomes thin and fragile. So, what is the cause of osteoarthritis? The breakdown of this articular cartilage and the joint itself is not attributed or caused by a single factor alone, and this goes for any other health condition, injury, or disease. Each condition presents with its own unique condition script. The condition script for osteoarthritis, we need to consider the interplay between both genetic components and environmental components. We can refer to this as internal and external factors. Internal factors include anything from genetics, hormones, and abnormal joint anatomy. However, this is only one piece of the puzzle when considering the risk of developing osteoarthritis. This is because our bodies are in constant interaction with the environment. In both the world of research and in clinic, the development of osteoarthritis has more strongly been associated with modifiable external factors, risk factors such as obesity, joint injury, poor movement patterns, and decreased muscle strength. Our best medicine is prevention through activity and movement. Now, a common misconception regarding osteoarthritis is that it is solely the result of everyday wear and tear. However, in reality, this does not paint a complete picture. Everyday movement, and specifically movement under different loads and movement under different weights, is required in order for our joints, muscles, bones, and importantly, the cartilage to remain healthy. Cartilage is constantly going through a cycle of degeneration and regeneration, and the catalyst for this cycle is movement. So by venturing actively through our joints' full and controlled pain-free ranges of motion, we are allowing our joints to become more familiar and therefore stronger with different positions and different ranges. It is when we start placing excessively repetitive, high-impact, and torsional demands on the joint that we start seeing an increased risk of degeneration. For example, a robust risk factor is obesity because of the additional load and demands placed on the joint. So here are a few common signs and symptoms, but remember, with any health disease or condition, everything presents as a group or a cluster of signs and symptoms known as a condition script. Very rarely is it just a single feature alone. Now, this brings us to the end of the video. If you'd like to learn more about osteoarthritis, including management and prevention strategies, here are a few resources below. As well, our clinic is part of the GLAD program, which is a program for people with symptoms of knee or hip osteoarthritis. It is designed to teach patients about osteoarthritis, reduce their symptoms through education, and through supervised exercise classes. I hope this information shared will add to the conversation you are already having with your physiotherapist, physician, or healthcare provider, or open up conversations between you, your family members, and friends. Thank you for watching. See you soon.